Okay, so welcome everyone. Today our presentation is Let's Talk About Dementia, and our wonderful presenter is Melanie Williams from the Alzheimer's Association, and I am going to let her take over from here.
Great. Thank you so much, Kim, for making this opportunity available. I'm excited to share this information today and just talk about how dementia is, what it is, first of all, and how it's affecting our communities. Because most of my work is done under grants, I am asking if participants can provide their first name, last name, and a zip code. So I'm not sure if there's a chat where that can be done or if we can just collect that afterwards. But if I could get those, that would be fantastic. Go ahead to the next slide. So I am Melanie Williams, the program director for the Montana chapter of the Alzheimer's Association. And this is my mom, Audrey. I was actually a school teacher for about 30 years. And during the time that my own children were in high school, we started noticing changes in my mom's thinking. But since she's a type 1 diabetic, we attributed a lot of what was going on to maybe some unmanaged diabetes. But at that time, when this picture was taken in October of 2015, my mom knew something was wrong with her mind and with her thinking. And she kept bringing it up to doctors and talking to us about it. But because she was so incredibly educated and intelligent and had such a robust vocabulary, it was hard to see that it was probably dementia. So we thought of all sorts of other things it could be. In this picture, my mom and I are in San Francisco. She wanted to go down and get some brain scans done at a specialized clinic down in San Francisco. And what was amazing is she would go in and talk to the neurologist and have these very sophisticated conversations with them about the mind, because she'd always been very intrigued with the mind. But we'd go downtown San Francisco, and it was like we were seeing it for the first time every night we were there. We were there almost a week. And every night we went downtown or down to the waterfront, it was as if she had never seen it before. And I kept thinking, what is going on? I mean, we're having these incredibly high intellect conversations with doctors during the day. And then at night, it's like 51st dates over and over. We're seeing the same place for the first time every night. So I called my brother and I said, something's really wrong. Go ahead and go to the next slide, Kim. So this is my mom this last year. And sadly, in San Francisco, they told my mom that she was 10 years away from being told she had the first signs of Alzheimer's. Yet here she is now, and she's already in a memory care and in the middle to late stages of some form of dementia. We don't know what type, but it progressed from the time we were in San Francisco to where she is now living in a memory care unit. She was finally diagnosed with dementia by a doctor in Billings. It was undetermined dementia, so it's a very vague diagnosis, but it at least gave us some answers to some questions that we had. So that's my story and how I became involved with Alzheimer's and dementia education, and hopefully providing more resources and education to people around the state. I know for myself, I felt so isolated and so alone, and as if I were on an island trying to navigate this journey. And I don't ever want anybody to feel that way. So that's my why. Go ahead to the next screen. The first thing I want to do is define dementia and then talk about the types of dementia. Dementia is the overarching umbrella term we use to describe all forms of dementia. Alzheimer's happens to be the most common type of dementia, with 60 to 80% of the people living with dementia living with Alzheimer's. We also have vascular, Lewy body, frontotemporal, others including Huntington's and Parkinson's disease. In all honesty, though, most people living with dementia probably have a mixed dementia. We have a volunteer in Butte who just received the autopsy reports for her brother, and there was evidence of 3 different types of dementia. So there's not always a clear-cut answer when people say they want a specific diagnosis. It's a lot harder than it sounds to find out what dementia somebody is living with. Go ahead, Kim. Here are some statistics that I think are staggering and bring to light what we are facing in our country right now. 1 in 3 seniors dies with Alzheimer's or another dementia. It doesn't always mean they die from it, but they do die with it. It kills more than breast cancer and prostate cancer combined. The lifetime risk for Alzheimer's at age 45 is 1 in 5 for women and 1 in 10 for men. We do know that women are more likely to develop Alzheimer's or dementia than men are. Between 2000 and 2019, deaths from heart disease decreased 7.3%, while deaths from Alzheimer's increased 145%. People often ask me how you die from Alzheimer's. This is specific to Alzheimer's, but if somebody lives long enough and doesn't die from another comorbidity such as heart disease or diabetes, Alzheimer's actually affects the ability to swallow. So people in the late stages of Alzheimer's lose their ability to swallow. Oh, sorry. In 2023, Alzheimer's and other dementias cost the nation $345 billion. And I'll talk a little bit throughout the slideshow about where that money comes from. That cost could rise to nearly $1 trillion. While only 4 in 10 Americans talk to their doctor right away when experiencing early memory or cognitive loss, 7 in 10 would want to know if they have Alzheimer's disease, if it could allow for earlier treatment. I think part of the fear is people are afraid they'll be declared incompetent, which is not true. They still can make legal decisions, especially in their more lucid days where they're thinking more clearly. Go ahead to the next slide. This graphic shows the impact of Alzheimer's on the workplace. And this is where I was when my mom started experiencing signs of dementia. It's called the sandwich generation. So it's people that have children 18 years and younger, and then also have a parent that they're caring for, and they're maybe still in the workplace. More than likely, they're still in the workplace. So this is the impact it has on jobs, people's careers, and on the workplace environment. 6 in 10 caregivers were employed in the last year. These individuals worked an average of 35 hours per week while caregiving. And we know the impact of caregiving. People are exhausted emotionally and physically. So some of them have to work. They don't have the means to provide for themselves not working. So they have to work. And then on top of that, they're also trying to provide care, which for somebody with dementia can be 24/7. It can be exhausting. 18% of caregivers went from full-time to part-time or cut back on hours. 9% of caregivers gave up working entirely. And I know it sounds like an easy solution. One might think, well, yeah, it seems logical to maybe quit your job to care for a loved one. But the task of caring for somebody 24/7 who has dementia is some caregivers will predecease the person living with the disease because it is so wearing. And then they also might not have the financial means to be able to quit. And I know for me, I find my work very rewarding, and I find my career very rewarding. And as much as I love my mom, I'm not skilled to take care of her in the current condition that she is. I'd probably need to get some more training to take care of her in the current condition that she is. 50% of employed caregivers had to go into work late or leave early or take off time due to caregiving demands. At the time my mom was struggling, I was teaching middle school, and it was actually kind of cute because if my mom called during the day, my students got to the point that they would say, "It's okay, Mrs. Williams, you can answer it if it's your mom," which I thought was very sweet. But she became so confused that she would lose her car or forget where things were and call me, not knowing what to do. She'd feel sick, so she'd walk to the hospital and want to be admitted. So these were all things that I was dealing with while I was trying to teach, and often had to leave my teaching to go help her go find where she was or figure out why she was trying to get admitted to the hospital. Approximately 1/4 of caregivers are in the sandwich generation. I just talked about that. 83% of care at home is provided by family members, friends, or other unpaid caregivers. So for example, one thing we're going through right now, my mom, who is living in memory care, like I mentioned, and is in the middle to late stages of her dementia, fell and broke her hip a little over a week ago. So she had a hip replacement surgery. Sadly, no rehab center in the area where she's living now would take her because of her dementia. So what that required is for my brother and my sister-in-law and I to take time from our jobs to find the appropriate equipment so we could take her back to where she was living, to find outside care that could come in and offer an extra layer of support. We are also spending time with her. She's fallen 3 times since this surgery because she forgets, and she's a go-getter. She wants to get up and get going. And so she gets up to try to go, and she falls because she forgets that she's had this hip replacement surgery. So that's what we're doing is considered unpaid care, because we're having to provide her care that she would normally get in rehab. We're providing the equipment, we're providing our time to help through this time of her recovery to hopefully get her to the point that she can once again live like she was living before in her memory care. And then approximately 2/3 of women, 2/3 of dementia caregivers are women. So not only are we more likely to develop Alzheimer's or dementia, but we're also more likely to be the caregiver. Go ahead, Kim. There's some staggering statistics on the Native American population, but I just wanted to share these for today. More than 2 in 5 report having experienced discrimination when seeking health care. So one thing we want to try to do is develop relationships to develop that trust so that if they have concerns with memory, they feel comfortable speaking to a provider or to a healthcare professional. 40% believe that medical research is biased against people of color. And this isn't just true for our Native Americans, it's true for our African Americans and Hispanics as well. And then more than 1/3 do not believe that they will live long enough to develop Alzheimer's or another dementia. And that one seems to be very true in Montana, especially with the opioid epidemic. They don't even see living long as something that they'll know in their life. Go ahead to the next slide. So we're going to talk, I'm going to give you a brief overview of the 10 warning signs of Alzheimer's disease in the next few slides. So go ahead, Kim. The first one is memory loss that disrupts daily life. We all have those moments where we forget somebody's name, we forget where we set our keys, we forget where we set our phone. Usually we can retrace our steps, or later the name comes to us and we're like, oh yeah, that's right, now I remember their name. Or we ask somebody, where it's like, oh yeah, now I remember. Memory loss with dementia is different because often the memory is totally gone. They can't even retrace their steps. So the example that we use is somebody walks into the house, they have their car keys in their hand, they get a call on their cell phone. So they answer the cell phone, set their car keys down by the table by the door, and then proceed to talk on the phone for a while and get settled in at home. A while later, they might wonder where their car keys are, but usually with dementia, that short-term memory is gone, so they don't even have the ability to retrace their steps. So when they find the keys on the table by the door, or somebody else finds them for them, their first thought is somebody's moving the keys on me. I would never put my keys there, because they've lost their inability to retrace their steps. For many of us, as soon as we see the keys on the table, we're like, oh yeah, I remember I got that phone call and set them down, and we don't give it another thought. But in their mind, they didn't ever set them there. I also use the example with my mom. When she lived in Helena, she lived near Albertsons. So she knew she needed to eat some supper. So she would drive to Albertsons, the closest Albertsons, buy her groceries for supper, walk out, and then walk home thinking she'd walk to Albertsons, and then call me saying she couldn't find her car because she couldn't retrace her steps to remember that she had driven to Albertsons. The mind is just fascinating to me when you think about that, about what it is able to comprehend and process, and yet with the memory gone, how much it loses in that process too. Next one. They also have challenges in planning or solving problems. So all of us go through a day pretty typically, and little things might pop up, like today with the IT challenge, for example. Little things might throw us off, but we work through it. We usually problem solve. We figure out what's going on. We solve it. We move on. Somebody living with dementia loses that ability to problem solve. So when something's not working, they don't know how to figure out how to fix that problem. My mom was a type 1 diabetic, as I mentioned, and she had a pump. And I noticed it got to the point that when her pump wasn't working, or her pump was telling her she was almost out of insulin, she forgot what to do. She could no longer remember the steps of what she was supposed to do. So just those typical everyday little glitches that we run into become very cumbersome and very challenging for somebody with Alzheimer's or dementia. It might also take them a lot longer to complete tasks, and they might start making errors where they didn't before. Next slide. They might have difficulty completing familiar tasks. I always use the remote control as an example for this, although don't get me wrong, my remote control perplexes me most days. But let's say something technical like a remote control, a computer, a microwave, things that maybe a game that they're used to playing, that they've played all their life, something that they're very, very familiar with, all of a sudden becomes very difficult or challenging, or they don't remember the rules of the game. They don't remember how to drive to a familiar location. I heard about a man who was a principal at a high school for years. And one day he showed up back at the house and his wife said, "What are you doing?" And he said, "I don't remember where I work." And he had driven to that same high school for years. So difficulty completing familiar task or something that they know very well can also be a sign. Next slide. Trouble understanding visual images and spatial relationships. Their eyesight does change, and it's not necessarily something that glasses can fix. Their perception of things becomes very difficult. And what I've especially noticed just in my own observations is if there's a black piece of clothing on a black chair, they probably don't see it. They don't see the 3D effect of it to see, oh, there's something on that chair, or white on white. When my mom was in the hospital last week, she dropped a white washcloth into the sink when she was washing her face, and then she couldn't find it again because it was white on white. So she was feeling around trying to figure out where it was. This becomes especially prevalent when they're eating. Most memory cares will use like bright yellow plates because then the food is a contrast and they can see the food. But this will lead to trouble reading. It will lead to difficulty with balance. And they'll also start to lose their peripheral vision, which means when you approach somebody with dementia, you want to make sure that you're in front of them and at eye level with them, not coming from behind or from the side, but really coming right in front of them and at their eye level where they can see you. Next slide. They'll have problems coming up with words that they've maybe used all their life. They might start to describe things rather than using the word. For example, instead of saying a toaster, they might describe to you what it does. They might make up words. They might start repeating words a lot that they do know. We all struggle to find words. That's something that's normal every day. But somebody with dementia will increasingly struggle with finding words and then not be able to retrieve the word at all. Next slide. Decreased or poor judgment. Oh, did I miss one? Oh, misplacing things and losing the ability to retrace steps. I think I already talked about this one earlier with the car keys. There we go. Decreased or poor judgment. They might start using poor judgment when dealing with money. I think that's when the family first starts to realize something's not quite right, is when people with dementia are paying for things that don't make any sense. They're buying things that don't make sense. They're spending money in a way that they haven't spent it before. And we always talk about, some people are like that all their lives and they don't have dementia. So we always talk about it as a change of behavior. If you all of a sudden see this decreased or poor judgment and it was never there before, maybe somebody was always a rule follower and all of a sudden they're breaking the rules, they're trespassing or trying to get into other people's homes or spaces or taking things from people thinking it's totally fine, that could be a sign because it's not something that they have always done. They might pay less attention to grooming or keeping themselves clean, and also their homes. I was up in Libby recently talking to the first responders, and they were talking about a gentleman that had a fairly neat home, not ultra tidy, but always seemed to be able to keep his home up. And when the first responders were called in for something, they noticed how messy the house had become. And they just wondered what to do in that situation, who to call. And I said, just remember that that's a symptom. That's a sign that there's probably some dementia. If somebody's always kept their house clean and all of a sudden it's full of garbage and things seem to be misplaced and there's no organization where there was before, that can actually be a sign of dementia. So rather than seeing it as, maybe something that's neglect or abuse, consider it to be a sign of dementia and seek help for the dementia as well. Next slide. Withdrawal from work and social activities, I think especially as they start to realize they're not able to keep up with the conversation, or that when they say something in the conversation, it doesn't seem to fit. I think they naturally start to draw away and become withdrawn. The world is full of stimulus. Every day that we go out, our brain is filtering through so much stimuli and deciding what to pay attention to, what not to pay attention to. And as their brain literally starts to shrink and parts of it start to die, it loses the ability to filter all of that information. And so what they tend to do is withdraw so that there's not so much stimulus that they're having to take in. This is why, too, we sometimes encourage people, if they're going to eat out with somebody who has dementia, to go maybe between 2 o'clock and 4 o'clock when the restaurants aren't so busy and there's not so much activity that they're trying to filter through. Next slide. Changes in mood and personality, they might actually become quite moody, and especially as the day progresses. Again, the brain's inability to handle their emotions and manage their emotions. I always say that not only is their IQ declining, but their EQ, their emotional, the emotional part of their brain is also declining and becoming maybe more childlike, in that they aren't able to manage those emotions like they once were able to. They can't talk themselves through the emotion. We might see a change in personality. Somebody who was very kind and caring can become very bitter and angry. So again, a change, if they've always been like that all their life, it may not be dementia, but if you see that change, then that's something to pay attention to. Next slide. So that's the 10 warning signs. We do have an education program called the 10 warning signs. I gave you the highlights of it. Actually, each of these has some little video clips to go with them, and we can do it as a 1-hour presentation with a little bit more information. So we'll talk about some of our education programs later on. Next slide. I wanted to talk a little bit today about compassionate communication. This comes up a lot, especially when people are concerned about somebody's behavior who's living with dementia. It seems to me that it often resorts back to some communication that was taking place with the person living with dementia. We do have an entire education program based on effective communication strategies. I've just pulled this handout that we sometimes use to hit some of the highlights for you today in working through with somebody with dementia, or maybe you know somebody who's trying to care for somebody with dementia, and you hear about the fights or you hear about the tension in the home or wherever they might be because of some communication strategies that are not being effectively used. So the first one is to be very patient and supportive. Let the person know you're listening and try to understand. We have one example of a woman who was looking outside of a big glass window. And as it became evening, she could see the reflection of her family members in the window. In her mind, though, those people were out in the yard, and she became very paranoid that there were people in her yard looking in at her. And so we always talk about, instead of blowing it off and saying, oh, that's not people in the yard looking at you, or trying to make light of it, just acknowledge, say, wow, yeah, I can see that it looks like there's people out there. And then we have one volunteer that says, you might even go out and yell at those people and tell them to get out of your yard. And then a strategy could be to pull the blind so she doesn't see them, but enter their reality, because that's really what she's seeing. And it's not like somebody with a mental illness where they'll come back to a lucid state and understand what's happening. Their brain is shrinking, and they can't see that for what it is anymore. They've lost that ability due to the brain shrinking and dying. Offer comfort and reassurance. When my mom was sundowning last week in the hospital, I would just let her know I was there, and then I would start playing Patsy Cline and Willie Nelson and some of those songs that she liked. But I always let her know that we were right there with her, that she was going to be okay, and we were there to help her through anything. If she was frustrated, I let her know I heard her. And then I also use two tactics, defer and deflect. And that just means try to change the subject to something she likes to talk about. My mom loves to talk about the farm where she grew up. So when she started getting agitated, I would ask her about a favorite dog she had as a pet, or something she enjoyed doing when she was a child, just to get her to think about something else when she became agitated. Avoid criticizing or correcting. If they say it's 1996 and you say, no, it's 2023, and you get into an argument, you're not going to win, first of all, and you're just going to agitate them and probably escalate behaviors. So we call it therapy fibbing or therapy lying. Just enter their reality and go along with it. We call it therapy fibbing or therapy lying because it reduces their anxiety. So our whole goal is to keep them calm, to try to keep those behaviors from escalating. It really, in the big picture of things, doesn't matter if it's 1996 or 2023, if they're at this point in the disease. So we just want to meet them where they're at. If you notice at the top of the worksheet, it says you can be right or you can be kind. Kind is better, especially with somebody with dementia. Avoid arguing. Again, try to go along with it unless their safety is an issue. Then, of course, you want to use other strategies to address the safety issue. But just if they think something's black and it's red, you just go with it that it's black. Offer a guess. If they can't come up with a word or can't think of somebody's name, you can offer a guess. Instead of correcting them, just say, oh, is it such and so? Or sometimes we even talk about the strategy of putting the answer in the question. So if you're asking somebody who is living with dementia what they'd like for lunch or where they'd like to go for lunch, if you say, where would you like to go for lunch today? Their mind has to work so hard to break down that whole question, to think of, okay, where do I want to go? So where means we're going to leave and go someplace. Okay, for lunch. Lunch means we're going to eat. Okay, where we're going to go someplace to eat lunch. Then they have to think of all the places they already eat lunch. So their brain has to switch gears and pull all of that up into their memory. And then they have to choose that place. That's such complex thinking that we don't realize on a day-to-day basis, but it's really taxing the brain. And I know sometimes it taxes mine when somebody asks me where I want to eat. I'm not even sure. So we often try to say things like, would you like to go to lunch at Wendy's or at Brew House? Or would you like to have a sandwich or soup for lunch? And if there's one answer you want them to say, you usually put that last, so that because they'll usually repeat the last thing they heard. So that's a way of making them feel like they're still a person, that they're empowered, they're still making choices, but offering them enough support that they feel successful. Encourage unspoken communication. They can point, they can gesture if they can't talk any longer. Limit distractions, as I mentioned earlier, maybe go to the store or to a restaurant during the quieter hours. Even in their physical environment, we have found with my mom, and that's why memory cares are so small, it's like swaddling a baby. If their home is very cluttered, even if it always has been like that, and there's lots of knickknacks and lots of things out and lots of furniture, it's really overwhelming for their mind to take all that in and try to decipher it. So if we can try to declutter their environment, keep it very simple, just keep it to things that are not maybe very breakable or valuable, that they can still touch and manipulate and move around, things like that. That's the safest and the best. Focus on feelings, not facts. When they're feeling very discouraged, I always tell people rational thinking and logical thinking won't work. So even if in your mind something seems very logical, if you could just explain it to them, it's probably not going to work. So just empathizing with their feelings and then maybe using that defer or deflect. My mom has a best friend named Marty. So sometimes when she's really down and depressed, or I'm having trouble getting her out of her feelings, or getting her feelings out of her, I should say, I just say, how's Marty? And she just instantly switches gears and starts talking about her best friend. So that's another strategy that can sometimes work too, to help them get out of whatever feeling they might be perseverating on. They don't have the ability anymore to process those. So we need to think of strategies to help them. When you walk up to somebody living with dementia, you want to, like I said, come to their eye level and then introduce yourself by name. So when I see my mom now, since she doesn't recognize me anymore, I just say, "Hey, Mom, it's Melanie." And I get right in front of her so that she can see my face. If you wear a name tag and you're in a facility or something, it's always helpful to have the name tag near your face if they can still read. We also want to use short, simple words and sentences, maybe talking about one thing at a time, one thought at a time. If you're living with the person with dementia and you need to get ready to go to a doctor's office or a doctor's appointment or shopping or whatever it might be, you might want to start to get ready early and just ask them to do one thing at a time. Like, first of all, find their shoes. Let them go do that, put their shoes on. Then tell them to find their coat instead of listing off 5 things they need to do before you go. Speak slowly and distinctly. We don't have to speak more loudly unless they have a hearing deficit. But sometimes I think we get confused with people with dementia and think we have to speak loudly too, and that's not always the case. Be patient when waiting for a response. Their brain is working so hard to come up with an answer, and we all are very uncomfortable in that pregnant pause. So we want to make sure that we give them a little bit of time to respond, and not act impatient, not tap our foot or tap our fingers, but just be patient and gentle when we wait. Repeat information or questions as needed. They'll ask a lot of questions and they'll repeat the same question a lot. And we often say, just pretend like it's a new question. Pretend like you've never heard it before because they don't remember what you said the first time. Turn questions into answers. So instead of saying, "Do you know where the bathroom is?" say, "The bathroom is right here, right?" Or "The bathroom is to the right." Or, I can take you to the bathroom now if you think they need to use the bathroom, instead of asking questions. Avoid confusing and vague statements. They become very literal, and I didn't realize how literal till my mom was in the hospital. And the physical therapist came in and she was trying to get mom she was trying to see if mom could straighten her out in her hospital bed to see if she remembered how to use her core strength to straighten her out. So she was trying to say, "Can you move your right shoulder by me?" Meaning, to sit up to bring her right shoulder closer to the physical therapist. But the way she said it, she said, "Can you move your right shoulder by me?" My mom said, "Oh, yeah." And she just started doing shoulder circles and wiggling it all over. And it was a reminder to me that they'll take what you ask them very literally. So yeah, in mom's mind, she was moving her shoulder great. She couldn't understand why that was such a tough task. So we had to use words like try to straighten your body or, try to sit up straight. They don't understand words like activate your glutes or, put your left foot forward. So we had to really think of words that would get her to walk other than trying to describe right and left or things like that. We would give her goals. Like I'd say, pretend like we're in Goodwill and you have a shopping cart and we're ready to go shopping, to help her with that. Avoid quizzing. Oh, turn negatives into positives. On this one, my mom's in a memory care and she knows it's locked and it drives her crazy. She always says, "We are locked in here." So I always try to say, I think they're locking everybody out because you pay good money to live in a nice place and you don't want strangers just walking in and eating your food and sleeping in your bed. So I try to turn it into a more positive situation than saying, "Oh yeah, you are locked in there." Avoid quizzing. We don't want to use the R word, remember, but sometimes we'll say, "What do you remember?" Like I'll ask my mom, "What do you remember about your childhood?" Or "What does this picture make you think of?" So we don't want to call on them to remember things because that often frustrates them. But we can say things like, how does this make you feel?" Or "What does this make you remember?" Or "What does this make you think of?" Write things down to give them more of a cue to remember, and then treat them with dignity and respect. They're still a person inside. They still want to be treated for who they are. Sometimes we use the analogy that if somebody were to come in with a broken arm, or like in my mom's case with a broken hip, and had their mind, how would we treat them? How would we treat them as a patient? And so just because somebody has Alzheimer's or dementia, we don't want to treat them as a lesser person. They're still a person inside, and we want to treat them as such. Next slide. We do have, like I said, a program on effective communication strategies. I just went through a very high level piece, but we have one that breaks down for the middle or early stage, middle stage, and end stage, and how communication might change through the stages. And then this brochure accompanies that program as well. Next slide. Especially for Montanans, I found this tool to be very, very helpful. This is the ALS Navigator. I get calls from people, like I said, Libby, Ekalaka, living in very, very remote areas, and they're just not sure where to go or what to do to get help or to get support for if they're caring for somebody with dementia or feel like they might have it. This ALS Navigator is a great tool for setting up an action plan. If you're worried about finances, it will ask you a few questions and then it will create an action plan, kind of telling you where to start. That's another thing I hear a lot from people is they'll call me and say somebody in their family was just diagnosed and they don't even know where to start. So I feel like this ALS Navigator really gives them a good idea, a good place of where to start. There's also action plans on here you can create for safety in the home. In Montana, we hear a lot about guns in the home and people wondering how to handle that. Dementia and driving can be a huge topic of discussion. We have a whole website, actually a whole page on dementia and driving. And then the ALS Connected is great for people in more rural areas too, because it's a discussion board where you can go and ask a question of the group to find out how they're handling a situation. During COVID, I accessed this discussion board and just asked how people were staying in touch with their loved one during COVID. There's lots of ideas on here. There's 3 strands, one for people living with dementia. So if somebody's living with dementia, they can join a discussion board for caregivers, and then there's a Spanish version as well. So those are some of our online resources that I have found people in Montana really appreciate if they don't have access, especially in the winter. We have people way up in Plentywood and Wolf Point, Glasgow, all the way down to Ekalaka, Libby, Southwest Montana, that just don't have any way to get to a support group or get someplace where they can meet with somebody to make plans or arrangements. So these are a good online resource. Next slide. The next 2 slides show all of our education programs. Like I said, these are all free. We don't want cost to become a burden for caregivers or people living with the disease. So today I kind of gave you a highlight of 2 programs. These programs, the way they're offered, are much more in depth, and there's a lot more content, but we have Understanding Alzheimer's and Dementia, 10 Warning Signs, Effective Communication Strategies, Healthy Living for Your Brain and Body, Managing Money, Dementia Conversations. That one's more about the legal and financial aspects, visiting the doctor, deciding when to stop driving, things like that. And then the next slide. We have a 3-part series called Living with Alzheimer's. So there's Living with Alzheimer's for people with early stage Alzheimer's and care partners, Living with Alzheimer's for middle stage caregivers, and then Living with Alzheimer's for late stage caregivers. We have a Living with Alzheimer's for people with younger onset Alzheimer's. The youngest I've heard of somebody being diagnosed with dementia in Montana was a 39-year-old male. It was a result of multiple head injuries, I believe. We also have a young lady at MSU whose father was diagnosed when he was 47 years old and she was in high school. He lives in California, but she's a student at MSU and just talks about what it was like to be a high school student and watching her dad go through this until they could finally get a diagnosis. And then another one that's very popular right now is Understanding and Responding to Dementia-Related Behaviors. I think especially with the 12 nursing homes or more that shut down and over 200 beds that we lost, more and more of us are being called on to care for our loved one that's living with dementia. I used our situation as an example that we're having to provide a lot of the post care for my mom. with her rehab and her behaviors as she tries to work through this recovery period from her hip replacement surgery. And many families aren't able to get a loved one into a facility who can help care for them. And so we're trying to provide as many tools as we can so that the caregiver doesn't become completely worn out. And hopefully the behaviors at home don't escalate to the point that the person's becoming combative or abusive or leaving and wandering away from the home. So that one, I think, is critical right now while we try to navigate this nursing home crisis that we're in. Next slide. We also have these online resources. Well, actually, our helpline's not. We do have a 24/7 helpline that is staffed with master level clinicians. I've actually called it twice for my mom, especially when she was perseverating on something and I could not get her off of it. I called them. What's so nice is you can call them at 1 a.m. when the person is perseverating or anxious or pacing, and you can get help right away in your situation. They are very kind. They are very understanding. One of the times I called, I just sat and cried, I think, for the first 15 minutes. I didn't even know where to start. So I highly recommend that helpline. The free education I was just telling you about, we can offer that in person, or all of those are available on demand on our website as well, so you can work through them on your own. And then we have a resource finder that we work on with AARP. It's a little hard to navigate, so sometimes I just say, just reach out to me and I'll help you find what you're looking for. Because now that so many things are virtual, it can be really overwhelming when you go on to that to try to find what you're looking for. Next slide. Thank you for your time today. I hope this was helpful. I think one of our main objectives today, not only talking about the disease, but how much it impacts families and communities. I mentioned how our family's been impacted by it. I mentioned the first responders in Libby, the ambulance drivers, the sheriff's department, being called into situations where somebody's living with dementia and trying to navigate that, since it's not necessarily a crime scene and it's not a medical emergency. So it really does impact not only the family, but the whole community. Our nursing home shortage right now is drawing a lot of attention to how much in-home care is taking place because of that. So I think it's going to take all of us, and the more education resources we can get in the tools of caregivers, I think the more effective we'll all be. And hopefully everybody's stress and anxiety levels will stay at a maintainable place so that we can all have better quality of life. So that's my presentation. Kim, I don't know if we might have a few minutes for questions. The difference between Alzheimer's and dementia. Alzheimer's is the most common form of dementia. So dementia is the umbrella term that we use to describe all dementias. Between 60 and 80% of the population is living with Alzheimer's. To find a scheduled class, you could actually email me at meawilliams@alz.org. How do you get family members? I think one of the biggest thing is to talk about how much the stress and anxiety can be reduced for everybody if we learn how to effectively communicate and not get caught up in arguing. That if you call the 24/7 helpline, those are all master level clinicians that are social workers. So that would probably be the best as far as people that really understand dementia in helping you navigate. And they can spend an hour with you on the phone if you need an hour. Going to a general counselor would be great. They might not understand dementia completely though. It is not known why women are at greater risk. I was just listening to a doctor last week, and it does seem to become more prevalent after menopause. They're not sure if there's more of a hormonal contribution to it, and that's why more women, especially when their estrogen levels drop, if that's why more women are at a greater risk for Alzheimer's. It's also known that women usually live longer than men, and the older you become, the more you develop the risk of developing Alzheimer's or dementia.
Awesome. So, just in case you need it, Melanie's email is meawilliams@alz.org.
As far as what I shared, we want our information to get out to anybody who needs it. So
Yeah.
please share what you've learned. People need us. They need all of us. We all need each other. So yes, by all means, share, share, share away.
100% agree with Melanie, and the website that I put in the chat there for benefits.mt.gov. I really appreciate you sharing your story, and that was just wonderful. So thank you.
You bet. Reach out anytime. I'm always here.
Okay, sounds good. And if we get follow-ups, or new information or whatever, we can always do another presentation or, whatever. So we'll keep in touch, Melanie, for sure.
Okay. Sounds great. Thank you so much.
Okay. Yep. Thank you, everyone. I hope you have a wonderful day.